Scientists are testing long-acting injectable anti-retroviral formulas which could change the way anti-retroviral therapy is administered. If the trial is successful, HIV patients would no longer need to take medicine on a daily basis. CGTN's Wilkister Nyabwa now reports.
For millions of people living with HIV and AIDS, anti-retroviral medication can actually be a dose of life. The treatment means they can lead normal, healthy lives. But after decades on medication, scientists note that fatigue is setting in, and many HIV patients struggle with the drugs which have to be taken at the very same time every single day for the rest of their lives.
For chronic diseases such as HIV, you always have challenges to take medications over and over. So, for example, if you've been on antibiotics just for 7 days, many people will tell you that they have forgotten like 2 days on their medicine. So imagine if you take medicine for 20 years and you have to take a pill every day. So plus the side effects of those medications.
That's where the idea of the injectable anti-retroviral medication comes in, a discussion which brought researchers together at the ongoing international conference on AIDS and STIs in Africa. The idea is to formulate a long-acting drug that can be injected in regular intervals of 4 to 8 weeks, giving patients a reprieve in between. It is technology that is closer than ever, as 2 pharmaceutical companies have submitted 2 drugs, cabotegravir and rilpivirine, for testing and approval. The combination of these 2 antiretrovirals has been shown to be just as effective as daily oral therapy, but the injectables are yet to be approved for general use, and researchers warn that even if the drugs pass every test, it could take up to 5 years before they are accessible to the public.
And this one is actually reaching the last stage, which is like pre-market. And there you can say, oh, I see it is coming. That's why the idea of very soon, or 2 years, 2 to 5 years, has been mentioned. But we always don't want to say to create false expectations.
Researchers want to find out what side effects, if any, the long-acting ARVs could have. The possible cost implications for such life-changing treatment are also still unclear. However, for millions, especially in Africa, where the majority of people with HIV and AIDS live, this development shines a ray of hope.
So long-acting to me is like that kind of boost or message to patients. Please, the few steps remaining, you're almost there, then you get that treatment.
It's another step forward in the fight against HIV and AIDS as the world searches for a cure. Wilkister, Nyabwa, CGTN in Kigali, Rwanda.